For the last speaker, but not least, we're going to present you the role of civil society specifically for countering the COVID-19 epidemic, which is widespreading and have a dynamic waves that you have already seen. So today we have a chance to host Ms. Nanut Mathurapot from the National Health Commission Office. She has been working in NHCO for around 13 years and as a head of Global Collaboration Unit. She will enlighten us the role of civil society to control this epidemic. And Ms. Nanut, the floor is yours.
Thank you. We keep thinking whether COVID-19 is good or bad, because COVID-19 tests our health system, and not just in Thailand, but globally. But at the same time, it brings society to unite and try to solve problems together and try to close the gap that we find. And today I'm going to talk about activities of civil societies during COVID-19. Then I will show you the global picture of government and civil society engagement during COVID-19. At the end, I will bring you to Thailand and see what the picture of Thailand on engagement of government and civil society. I don't want to go into details of civil society activities because more or less it's the same in any countries. But when COVID-19 happened, I'm thinking of HIV/AIDS at that time. At that time, the role of civil society, NGOs, and community were highlighted because the government need someone to support their work as well. And this is similar to COVID-19 because it's more than health. COVID-19 is more than health because it affects quality of life, including economy and so on. So civil society actions synergize government COVID-19 response really. And if we try to categorize the actions or roles of civil society, I would like to divide it into three groups. Response and prevention, and rehabilitation, and policy advocacy. And we found out that the outstanding roles of civil society is to reach out vulnerable groups, especially if you are in the community. If you know better who are the vulnerable groups, right there, you not look at the database, but you see them oftenly. I remember Wang Tonglang, I guess, Wang Tonglang community, they do database by themselves long time ago. Then during COVID-19, they expand the data collection to focus on the vulnerable groups. Definitely it's similar to the elderly group, the elderly people, the handicapped or children. But surprisingly, they add on a single mother as well. But this single mother is not considered as vulnerable group according to government criteria. But as a community, as a civil society living in the community, they see that a single mother has a burden quite a lot during COVID-19. Apart from that, when talking about risk communication, I'm sure civil society can do it quite better. At least they use the same language with conversational language with others. But Even though we realize the value of civil society or communities or volunteers, but look at the pictures of government and civil society engagement during COVID-19. There are two surveys on this issue. The first one in 2020 in April, conducted by UHC 2030 Civil Society Engagement Mechanism, collaboration with the Social Participation Technical Network. They did the survey and they got 200 respondents, but this is mostly our civil society answered the survey. The survey covered 58 countries in Africa, Asia, North America, Latin America, and Caribbean. The main finding is the majority of response reported there was little or no involvement of civil society in national COVID-19 responses. In 2021, there is another survey, rapid survey, conducted shortly from 20 May to 4 to June 2021, conducted by the WHO, the European Public Health Alliance, and EuroHealthNet. Cover 18 countries in European region, which have the higher income western part of the region and the upper lower middle income eastern part of the region. And there are 32 respondents. Let's see the main finding. More than half of respondents stated that civil society work remained largely independent from the government-led COVID-19 response. Some 32 out of the 34 respondents reported that civil society representation was absent from their country's COVID task force. Roughly 2/3 of all respondents described government's engagement with civil society actors as sporadic and unsystematic. Perhaps not surprised, isn't it? So the key message from the two surveys is value added, but disconnection between civil society action and the government's COVID-19 response. Look at, I will show you the picture of Thailand. We have alternative health workforce. I don't want to repeat 100 times about village health volunteer. You have heard from many times throughout the workshop. We value them and they are part of the health workforce. We not just get them and let them work. We train them. We have retention for them to stay with us. Apart from that, during COVID-19, I would like to echo from the video that you watched before that we have health volunteers for migrant, and some of them are migrant workers and some of them not. And we have volunteers for COVID-19 call centers that even National Health Security Office have call center, and my organization are part of their volunteer to pick up the phones as well. Oh, and I, not just the National Health Security Office, Ministry of Public Health also have a call center, and my organization as an organization are their volunteers to pick up the phones too. Community measures for COVID-19 response. Yesterday, we talked about health charter already. Yesterday, the health charter that I mentioned is more talking about the vision of the community on health and development, but they apply it to respond to COVID-19 as well. So they bring up community members plus public health officers or hospital director or doctors or village head to discuss how to respond COVID-19 in their community. As we survey this year, there are 2,400 health charters focusing on COVID-19 were developed in different administrative levels, or about 30% of local governments. And apart from that, we have a National Health System Charter of Buddhist monks in 2017. According to this charter, the Sangha, or meaning Monk Supreme Council of Thailand, had a resolution on temple isolation on 10 August this year, meaning everyone tried to work on to cope with COVID-19. And this is just a picture of like community discuss on how to create community measures or health charter. These measures is become more practical, which is tailor-made to a community. For example, if you are Muslim community, you may be focused on how to go to mosque and so on. Or if you are a Buddhist community, you may thinking further on about the funeral, thing like that. How to manage funeral during COVID-19, which more quite specific. And I read one charter, interestingly, they're saying that because everyone like stressed and depressed, and one of the action areas, I would say, kind of stay home and do meditation for that. So it's more quite like practical and quite specific, and that's lovely. This is the third one is community or factory or temple isolation. We have the government-led community isolation, but I would like to bring up a case of Nakhon Pathom model on community isolation complex. This is the collaboration from various actors, like the governor of Nakhon Pathom province, provincial public health office, university, institute under Christian church, Thai care database system, and provincial health assembly network, and all media. They collaborate not just to set up the community isolation complex, but more thinking the whole system of care management. This is just an example. I try to simplify the system for you. So if you are patient and you could get a self-test, or you got a test at the hospital or screen site, the green one, the green colors is the government-led organizations. Then if you are just a symptomatic patient, and if you cannot stay home, and you need community isolation, or you want a bed, apart from you contact through channels of the government, you can go to Thai.care. This is a network run by volunteer and civil society, together with health professionals, definitely, but health professionals are volunteer too. And you can call them or email or go to Line application or to website. In order you will get screening, assessment, and if you need a hospital, they will contact a hospital for you. And if you need to go to the community isolation, they can find an ambulance or a car to community isolation. So this is an example of community isolation complex that managed by multi-sectoral committee appointed by the governor. This is in Nakhon Pathom province, and it's fully provided food, bedding, fan, soap, toothpaste, washing bowl, hanger, extension socket, simply like a hotel, but it's free. And if you're talking about the budget, it's cost sharing with many actors, including civil society and volunteers. I have mentioned about Thai Care. Thai Care is actually a care management as well as a database management of COVID-19 patients run by volunteers, community, civil societies, cover 22 provinces, including slum area and migrant community. If you look at on the left-hand side is the chat box, is the chat box in not Thai language. We give consultation to migrants as well. And the Thai Care system, the red one here is, if you need help, click here, and you fill in the information that you want. The green one here, if you want to offer help, click here, say and write down, fill in what you can contribute to society, and they kind of a matching help and offer. Currently, there are almost 12,000 cases registered in Thai Care system. And not just Thai Care system, we have other system called Sendai as well. The Sendai system, Sendai means sewing thread. Thread means connecting everything for you, kind of one-stop service. The fourth one is COVID-19 patient database. The point is, in many, you could have like Thai Care, which is community database system alone, not linked to the government database. If this happens, it doesn't work because no one sees the real pictures of a patient database. But we have signed MOU. My organization is a part of Thai Care system, and we already signed MOU with involved organizations, especially it's called GIFG. It's kind of government organizations working on big data, analysis and management. And they create CoLink. It's government database system called CoLink to support Department of Medical Services. And now the two systems are integrated and have a linkage to each other. The good thing that when we have a linkage each other, Thai Care system, they have the system not mostly, but at the community level, the slum area and migrant community. So this will supplement information for the government so that when you solve the problem, you can see the most overall picture as possible. Policy advocacy. And if you remember the survey, they see that the COVID-19 task force of the government in many countries don't have civil society on board. But if you look at the National Communicable Disease Committee resolution recently in August 2021, there is one point saying, give permission to a representative of Provincial Health Assembly to attend the meeting of Provincial Communicable Disease Committee in order to receive information from the committee, as well to give input to the committee to improve measures. This is unbelievable. And this is help the work of both sides, really, and give a public trust to the government-led COVID-19 response. Another policy advocacy. Yesterday, I already mentioned about National Health Assembly. If you look at, because it's a platform, it's a year-long process, and also a platform that multi-sectors, both government, not just the Ministry of Public Health, attended, as well as civil societies and academia. Look at the resolution last year. It's talking about participatory health crisis management for pandemics. And currently, Ministry of Public Health adopted and implement according to the resolution. The second one is food security in crisis. I have to say that during lockdown, urban poor has problem with access to food. So this issue has been raised up. And Ministry of Agriculture adopt this resolution and agree on this, like totally agree on this resolution, and try to put this issue to the next National Economic and Social Development Plan. This year, we are going to organize in December 2021, very soon, is coming soon. There are 3 topics, 3 agendas that we are going to discuss. The first one is healthy environment in COVID-19. You know that we have waste management, infectious waste management, and lots of things on that. The second one is access to health services by specific population in crisis. A specific population means marginalized or vulnerable people, but we try not to say those words because somehow it's humiliate them. So we try to use specific populations. And the last one is communication. Is important during crisis. Apart from that, we are in the process of convening an issue-based health assembly on access to health services by migrant in February. There are many government organizations working on migrant together with NGO and civil society. It would be nice if all actors has discussed on this issue for sustainable problem solving. So the key message from Thailand experience is we have systematic connection between civil society action and the government's COVID-19 response. And that's all from me. Thank you.